John M. Jakisik. I'm a distinguished professor and chair of the Department of Health and Physical Activity. The objective of the study was to examine whether or not when we gave a behavioral weight loss program to individuals who were overweight or obese, if we added wearable technology, something that actually monitored physical activity and energy expenditure, whether that would actually enhance the weight loss over 24 months. We studied 470 young adults, and we defined young adults as 18 to 35 years of age, and they had to be meeting the criteria of being either overweight or obese. The results of the study showed that engaged in a weight loss program, a behavioral weight loss program, resulted in significant weight loss over 24 months. However, when we added the technology to that weight loss program, it actually hurt the weight loss by about 2.4 to 2.5 kilograms. So wearing the technology actually resulted in less weight loss than not wearing the technology. There were a few limitations to the study. One is that the device that we used was current about 5 years ago when we actually did the trial. And these technologies have evolved since the trial actually started. So the technology we used was worn on the arm, and these technologies now are worn on the wrist. So of all the limitations, that might be the one that is the most important. At the end of the day, I think the conclusions are that these behavioral programs continue to be very effective for weight loss for many, many individuals. And I think we have to be a little bit cautious about simply thinking that what we can do is just add technologies to these already effective interventions and expect better results. And in this case, we actually saw a little bit less results. So we just have to be a little bit cautious about thinking just because we can do these things that we should do these things, because in this case, the evidence doesn't support that. Clearly, the next steps are to go back and to think about more contemporary devices that are out there on the market at this point in time to see if they would result in any different effects. However, probably more importantly is for us to try to understand for whom and when these devices are actually very effective. So for some individuals, these might be very effective. For other individuals, they may not be appealing and be less effective. So I think we have to tease this out a little bit and try to understand when and where and how we use these technologies before we just simply implement them broadly across the population.